And next, we're going to hear from Lisa Hayim uh, about using and sharing our own strategies, harm reduction and mutual aid. So if we could have Lisa's, oh, there she is.
Hi, my name is Lisa Hayim Carver. I am a brown woman. I use the pronoun she, her, with short brown hair, and I am of North African Arabic descent. My adventures with long COVID, and I can have the next slide, please. This journey started in July 2020 when I got COVID from a situation where I had to give emergency first aid. I did not get very sick at the time, a lot of neurological symptoms, nausea, dizziness, fatigue. But several months later, I ended up in the emergency room with mild myocarditis. And from that point on, developed a lot of the symptoms that you've heard about tonight. And I know many of you are familiar with them. I am not a person who is living with HIV, but I am a cancer survivor. And I have worked in HIV and other public health arenas as an activist for about 35 years. So I still experience, since that time, a variety of different symptoms. I live in Miami. I have medical insurance, but I have not been able to get good care. I was referred to a post-COVID clinic, but after about 6 or 8 months, the doctor told me that I should be better by now, and that these symptoms on this slide, which I listed that I still have, muscle aches, joint pain, nerve pain, headaches, dizziness, difficulty balancing, fatigue, muscle wasting, and brain fog, which feels like shortness of breath for me, that these were probably due to something else, and sent me for a lot of tests. She said, maybe you have cancer again, which I do not. And I was offered a variety of medications, but I am someone who doesn't like to take medicine unless there is really a need for it. And the doctor became impatient with me and told me that there was nothing that could be done, and that this is all new, and they just didn't know what to do, and that basically she could not do anything else. So I am a person who I work a lot. I work in public health still, and in HIV. I support a lot of different community organizations, especially small grassroots organizations here in South Florida, as well as around the country. And I just felt like I was losing myself. I was losing my grip on just being able to function. And I kind of, I don't know, forced myself to take matters into my own hands. I don't have really a family or anyone that can really provide support. And if I could have the next slide, please. And this is my first time really speaking publicly about this. So I think probably a lot of this information is things that people are already doing, but this is what is helping me function. I'm able to work. First of all, I am someone who worked out almost every day before I got COVID. And that has been a continual struggle because my body won't handle the kind of workouts that I used to do before. They were pretty intense. But what I do find is that it does help me to be physically active when I'm having a flare-up of the symptoms that I described. I will still, if I can, walk for about 30 or 40 minutes, even if it's really slow. I've also found Qigong and Tai Chi to be very helpful to me, even when I'm having a lot of muscle pain or fatigue, if I can manage even 10 or 12 minutes, it really helps me a lot. When I'm not having a flare up, I've kind of worked to increase the time that I exercise incrementally. Sometimes that backfires and I do get the post-exertion malaise and other symptoms that other people describe. But when I feel better, I go back to 20 minutes and then 30 minutes. Sometimes I can do longer than that, and I will do yoga, more walking, sometimes step aerobics, weight training, although I haven't been able to go up on my weights to heavy weights like I used to do. 5 pounds is my max. Sometimes I can do 8, and I am trying to build back up and hoping that one day I will be able to. I also, I love sweets, but I have found that I have to really, really watch my sugar intake. I've always eaten kind of a plant-based diet, but one thing I'm learning is that my body responds differently to different foods now. And I'm realizing that sometimes I need to try different things. I now eat fish, maybe once a week, once every couple of weeks, and that does seem to help me with the fatigue. Also, a lot of times I don't have an appetite, but I still try to eat small meals or snacks. Hydration helps immensely, but may seem very obvious, but when I'm having a flare up, I tend to just not be able to do much, and including I don't drink water. I don't hydrate myself because I don't have the energy. So I'm learning that I need to do that no matter how badly I feel. And then the other thing is, for me, is being quiet. That has been a struggle. And I don't mean that in a funny way. As it was mentioned earlier, there are other symptoms besides physical ones that go with long COVID. And one of them for me is really isolation. A lot of my friends didn't understand and still don't, that I just don't always have the energy that I used to talk to them on the phone, or in person. And that has resulted in a lot of isolation for me because they've taken it personally, even when I explain why. So it's just something for people to be aware of, that this stuff is real. It's not something that people are making up because we don't want to talk to you. And so being quiet is one of my strategies for managing my symptoms. And when I feel really bad, I will say that a couple of Tylenol sometimes really helps. These are very simple things, but for those of us who are used to being out and on the front lines and being really active and fighting for what we believe in and what communities need, these are things that is very hard for us to do when we're not used to not having the energy to do what we normally do. So these very basic things have been extremely helpful to me. And if there's one thing on there that you haven't been doing, maybe I gave you a new idea tonight. But I just want to really appreciate everyone else who spoke tonight. I got a lot out of this. And I hope that we can make progress with this fight to overcome what we're experiencing and our communities are experiencing. And I really want to thank everyone who's out there fighting for those of us who have less energy to do that right now. Thank you.
Thank you, Lisa. And on the question of advocacy, you and Philip are great examples. For instance, Philip mentioned that he took to the streets with ACT UP when he was able to do so. But today his advocacy looks very different. However, it's no less powerful. Same with you, Lisa. You are sharing with others your experiences as tools to navigate the complexities that everyday life presents. So for those of us living with complex chronic conditions, Every time we advocate for ourselves with a medical or service provider, as difficult as it might be, we're advocating for others as well. And for those of you working in the systems that can make a difference in what we may encounter when we seek out support, care, or resources, every time we advocate to put people above politics and profit, we're opening the doors for others to survive and thrive.